Hello and welcome to the T-Level Healthcare Science Content Buster, exploring ethical and legal frameworks in research and professional practice to empower T-Level Healthcare Science students. Please remember that the information provided here is based on data available as of November 23 and may not reflect future changes to guidance documents. Always refer to the most up-to-date guidance. So today we're going to By the end of this training, participants should be able to explain the purpose of employment contracts and identify key elements of employment legislation, such as the Employment Relations Act 2004 and the Employment Rights Act 1996. You should gain a comprehensive understanding of the importance of professional practice, codes of practice including their role in shaping professional behaviour and fostering trust in healthcare organisations. You should have a strong understanding of HRA approval and the concept of informed consent in research. You should be able to identify key ethical procedures such as autonomy and informed consent and understand their importance in healthcare practice. You should have a clear understanding of the importance of accuracy, attention to detail, and legibility of written information to comply with legal requirements, including the UK GDPR. Learners should be able to explain how personal information is protected by data protection legislation, regulation and organisational policies, while maintaining confidentiality of consultations and medical records. And finally, we're going to explore teaching strategies to give students the ability to apply ethical and legal framework effectively in healthcare science practice, ensuring patient safety, data privacy and the highest standards of care. So let's explore the importance of the following aspects for an assisting healthcare scientist in the UK. So employment contracts define the terms and conditions of employment, including working hours, salary, and benefits for health scientists. This clarity is crucial to know what is expected and what can be negotiated. Contracts outline the rights of both the employee and employer. Understanding these rights is vital for healthcare scientists to ensure fair treatment, access to statutory rights, and dispute resolution mechanisms. And employment contracts clearly state the responsibilities and duties of the employee. In healthcare science, this is essential to maintain professional standards and ensure the effective delivery of healthcare services. Relevant legislation in the healthcare science sector. So the Employment Relations Act 2004 is vital for healthcare scientists because it amended UK law around trade union membership and industrial action. Understanding this act is important as it affects the rights of employees to join trade unions and engage in industrial action, potentially impacting their terms and conditions of employment. The Employment Rights Act 1996 covers major aspects of relations under employment, including particulars of employment, leave, studying or training, and termination. It provides protection of wages and payments, ensuring that healthcare scientists are fairly compensated for their work. Knowledge of this legislation is critical for safeguarding one's employment rights and entitlement. And disclosure and barring service, or DBS check or results. A DBS check is essential for healthcare scientists because it helps ensure the safety and well-being of vulnerable patients. It is regulatory requirement in many healthcare settings to conduct DBS checks on employees. This process screens individuals for criminal records or other relevant information that might affect their suitability for working with vulnerable populations. Sufficient DBS check results are crucial for patient safety. It helps identify individuals who may pose a risk to patients, ensuring that only qualified and safe individuals work in healthcare settings. DBS results also provides reassurance to patients and their families, promoting trust in healthcare services. It is vital for healthcare scientists to undergo and maintain clear DBS checks to fulfill their roles, responsibility, and ethically. In summary, understanding employment contracts, relevant employment legislation, and the importance of sufficient DBS checks is critical for healthcare scientists in the UK. It ensures fair employment practices, protects employee rights, and most importantly, guarantees patient safety and trust in the healthcare system. So now let's explore the professional codes of practice, beginning with the purpose of professional codes of conduct. Professional codes of conduct are designed to guide healthcare scientists in maintaining ethical behaviour and upholding high standards in their professional practice. They provide a framework for ethical decision making and behaviour, ensuring that healthcare scientists act in the best interest of patients and the public. These codes serve as a critical tool for ensuring patient safety. By adhering to the codes, healthcare scientists are committed to providing safe and effective care, minimising the risk of harm to patients. Professional codes often align with legal and regulatory requirements, ensuring that healthcare scientists stay compliant with the law while delivering healthcare services. So now let's outline expected professional behaviours and attitudes. Professional codes explicitly outline the expected standards of behaviours and attitudes for healthcare scientists. They set the bar for professionalism, respect, and empathy in patient interactions. Following these behaviour standards enhances patient-provider relationships, as patients can trust that healthcare scientists will treat them with dignity, respect their autonomy, and maintain confidentiality. How does it link to the roles and responsibilities within individual organisations? These codes help clarify the specific rules and responsibilities within individual healthcare organisations. This ensures that all employees, including healthcare scientists, understand their roles and responsibilities, contributing to efficient and effective healthcare delivery. By defining role and responsibilities, the code promotes teamwork and collaboration among healthcare professionals. This leads to a more coordinated approach to patient care. And in regards to promoting confidence in the organisation, adherence to professional codes of conduct reflects positively on the healthcare organisation. It fosters a reputation for integrity, ethics, and high quality care, which can attract patient and stakeholders. When healthcare scientists follow professional codes, it instills confidence in patients. They can trust the organisation and its staff are committed to their well-being and ethical care. And finally, national guidelines and good practice. National guidelines, often integrated into these codes, set the standards for excellence in healthcare science. Healthcare scientists are expected to meet or exceed these standards, ensuring the delivery of the highest quality of care. By adhering to national guidelines and best practices, healthcare scientists commit to continuous improvement in their field. This results in better patient outcomes and advancement in healthcare science. In summary, professional codes of conduct are essential for healthcare scientists in the UK. They serve a moral compass, providing guidance on ethical behaviour, promoting patient safety, and enhancing confidence in healthcare organisations. Adhering to these codes ensure professionalism, respect for patients' rights, and the delivery of high-quality healthcare services. Regulatory bodies play a crucial role in the healthcare scientist research and professional practice in the UK. Here's a detailed explanation of their importance. The GMC is a leading regulatory body in the UK, responsible for overseeing the conduct and practice of healthcare professionals, including healthcare scientists. The GMC sets forth a framework of ethical principles, standards, and guidelines that all healthcare professionals must adhere to. These principles guide healthcare scientists in their practice and ensure they provide safe, effective, and ethical care. By adhering to GMC regulations, healthcare scientists demonstrate professional and accountability, which is critical for maintaining trust with patients, their families, and the broader healthcare community. The GMC's principles and guidelines prioritise patient safety, encouraging healthcare scientists to take all necessary precautions to protect the well-being of patients. This ensures that healthcare scientists are continually focused on delivering the safe and high-quality care. Next, we have the National Institute for Healthcare and Care Excellence, or NICE, guidelines. So NICE guidelines are evidence-based standards that dictate the best practices for healthcare professionals. They are an invaluable resource for healthcare scientists as they define the most effective and efficient approach to patient care. By following NICE guidelines, healthcare scientists can enhance clinical outcomes and patient experiences. These guidelines provide the latest evidence and recommendation for the diagnosis, treatment, and management of various health conditions. NICE guidelines promote consistency in care across the healthcare system. Healthcare scientists who follow these guidelines contribute to a healthcare system that offers standardized, evidence-based care to all patients. So what are their role in the healthcare science? Regulatory bodies like GMC and NICE provide oversight of the professional conduct of healthcare scientists. They set standards and expectations for ethical and effective practice. These bodies encourage healthcare scientists to engage in continuous professional development. This ensures that healthcare scientists stay up to date with the latest research, technology, and best practices, ultimately benefiting patient care. Regulating bodies are instrumental in quality assurance, setting benchmarks and conducting audits to assess the quality of healthcare services. Healthcare scientists who adhere to the standards set by these bodies contribute to the overall quality of healthcare. Following the guidelines and principles outlined by these regulatory bodies is essential for maintaining patient trust. Patients have confidence that healthcare scientists are delivering care that meets the highest professional standards. So in summary, regulating bodies such as the GMC and NICE are integral to healthcare scientist research and professional practice in the UK. They establish ethical principles, standards and guidelines that ensure patient safety, promote excellence in care and maintain the integrity of the healthcare profession. Adherence to these regulations and guidelines is essential for healthcare scientists to provide the best possible care and maintain public trust. So adhering to regulatory framework is fundamental in healthcare science. These frameworks, often enshrined in law or professional standards, ensure good clinical practice, minimise risks and protect patients. Healthcare scientists who follow these regulations demonstrate commitment to ethical and professional practice. Now that we have explored ethical and legal frameworks in professional practice, let's explore this in relation to research in healthcare science. Beginning with HRA, or Health Research Authority. HRA approval is vital in research to ensure that studies involving human participants adhere to ethical and legal frameworks. It safeguards participants' rights, safety and well-being. Healthcare scientists must obtain HRA approval to conduct research, demonstrating their commitment to ethical practice. The two key ethical principles in healthcare science, including autonomy and informed consent, underpin ethical practice. Autonomy respects patients' rights to make decisions about their care, while informed consent ensures they have full information to make informed choices. These principles guide healthcare scientists in respecting patients' rights and ensuring ethical care. Major ethical considerations in research include obtaining informed consent, protecting participant confidentiality, and safeguarding participants' rights and well-being. Healthcare scientists must adhere to these principles to ensure research is conducted ethically, respecting the dignity and rights of patients. Not adhering to ethical principles and regulatory frameworks can have severe consequences, including harm to patients, invalidation of research, breaches of confidentiality, and unsafe practices can result in harm to patients and legal consequences for healthcare scientists. Compliance is essential to avoid such negative outcomes. Once a healthcare scientist has taken into account ethical considerations, next steps in research is to explore safeguarding patient data in healthcare, beginning with protection of personal information. Personal information is protected by data protection legislation, regulations, and local policies to prevent unauthorized access and disclosure. Healthcare scientists are responsible for ensuring the confidentiality and security of patient data to protect individuals and maintain trust in healthcare services. Let's explore key legislation and principles that ensures this safeguarding. The Data Protection Act, or DPA 2018, controls the use of personal information by organisations, businesses or government entities. Healthcare scientists must comply with DPA to protect data and maintain privacy and confidentiality. The DPA aligns with the implementation of the UK GDPR, ensuring that personal data is handled in compliance with GDPR's principles and imposes strict rules and requirements on organisations that collect, process or store personal data. In the context of healthcare in the UK, GDPR has significant implications. GDPR introduces significant penalties for non-compliance. And finally, the Caldecott principles, which are a set of guidelines that aim to ensure the confidential and secure handling of patient data within the UK healthcare system. They emphasise the need to balance the sharing of patient information for effective care with the protection of individual privacy. The principles highlight the importance of justifying the use of patient data, ensuring it is handled securely and respecting the confidentiality of this sensitive information. Ultimately, the Caldecott principles are designed to build and maintain the trust in the healthcare system while promoting the responsible and ethical use of patient data. Let's explore these concepts. So the foundations of reliable healthcare data. So data accuracy is essential in healthcare science to ensure that patient records, research findings and clinical data are reliable. Attention to detail and legibility reduce errors, support evidence-based practice and contribute to patient safety. In relation to compliance with legal requirements in GDPR, data accuracy is critical for complying with legal requirements, including the UK GDPR. Accurate, legible records protect patients' privacy, reduce liability, and ensure that data is handled in accordance with data protection regulations. These factors ensure effective data management and compliance. So let's explore efficient data management and compliance. So you have the use of LIMS, or laboratory information management systems. These are essential for healthcare scientists in data management. LIMS ensure secure access, standardized reporting, and compliance with data protection regulations such as GDPR and Caldecott principles. LIMS enhance data security and compliance with regulations, contributing to the accuracy and privacy of patient and research data. Healthcare scientists benefit from efficient data management and legal compliance by using LIMS. These factors combine to ensure ethical and legal frameworks in research and professional practice in healthcare science. Let's explore teaching strategies to give students the ability to apply ethical and legal framework effectively in healthcare science research and practice, ensure patient safety, data privacy, and the highest standard of care. Let's begin with teaching activity 1, case study analysis. This activity will engage students in real-world analysis of case studies related to ethical and legal framework in healthcare science. On the left, we have your resources that you would need for this activity. So you would have case studies on employment contracts, professional code of conduct and DBS checks, copies of relevant healthcare science legislation such as Employment Relations Act 2004, Employment Right Act 1996. So summaries of these, and access to professional codes of conduct and guidelines, for example, GMC, NICE and Resuscitation Council. On the right, you have your procedure for this task. So you would divide students into groups, provide each group with a different case study covering topics like employment contracts, code of conduct or DBS checks. Ask each student to analyse the case study and identify ethical and legal issues. Encourage groups to reference relevant legislation and professional guidelines. After analysis, have each group present their findings and recommendations to the class. Facilitate a class discussion on the key takeaways and lessons learned from the case study. Next, teaching activity 2, research ethics simulation. So this activity aims to deepen students' understanding of research ethics and the role of regulatory bodies in the healthcare science. So our resources would be mock research project scenarios, role play materials such as participant consent form, research proposals, information on regulatory bodies like HRA and MHRA, and copies of relevant legislation and guidelines. And the procedure for this task would be to divide students into small groups and assign each group a mock research project scenario. Provide students with participant consent forms and research proposals for their respective scenarios. Instruct students to discuss and plan how to conduct the research ethically and within the regulatory framework. Encourage them to consider informed consent, confidentiality and protection of participants. Each group presents its research plan and ethical considerations to the class. After all presentations, facilitate a class discussion on the importance of adhering to research ethics and regulations in healthcare science. And finally, teaching activity 3, data protection workshop. So this activity focuses on the importance of data protection and compliance with GDPR in healthcare science. Your resources for this would be GDPR guidelines and materials, case scenario involving data privacy and Data Protection Act and UK GDPR documents. The procedure would be to discuss the impact of GDPR on healthcare data collection and processing, share case scenarios involving data privacy breaches or dilemmas. In small groups, ask students to analyse the case study and propose actions in line with data protection regulation, and have each group present their findings and justification. Let's explore a real-world application scenario. So this is an example of a real-world application. This can be shared with the students. You can ask the students, what is the response? What are the outcomes? You could ask students to do both an effective and an ineffective response, and then what the outcomes would be as a result. You can give a proforma with headings as can be seen here, with the responses on the left and headings for outcomes here on the right. Let's look at an effective response and resulting outcomes. So the response is effective for several reasons. The healthcare science assistant took immediate action upon discovering the data breach, reporting it to relevant authorities and initiating steps to address the issue promptly. This swift response is crucial in minimising the potential impact of the breach. This response aligns with the legal requirements, particularly by the General Data Protection Regulation and the UK Data Protection Act. Reporting the breach to the Information Commissioner's Officer and notifying affected patients demonstrates compliance with regulatory obligations. Transparent communication with both internal stakeholders and affected patients is essential. Providing clear and timely information about the breach, its extent and the actions taken builds trust and helps manage the potential fallout. Collaboration with the ICO and cooperation in their investigation not only demonstrates a commitment to rectifying the issue, but also shows the willingness to work with regulatory bodies to ensure compliance and accountability. The commitment to reviewing and strengthening security measures is crucial for preventing similar incidents in the future. Continuous improvement in data protection practices is key to mitigating risks and maintaining compliance with evolving regulations. This response reflects ethical considerations, acknowledging the sensitivity of patient data and the responsibility to safeguard it. The prompt and ethical handling of this situation contributes to maintaining the integrity of healthcare professionals and the organisation. The effective response would result in the following outcomes. The organisation faces legal consequences in the form of potential fines and penalties. The outcome underscores the accountability of the organisation for the breach, reinforcing the seriousness of data protection obligation. While the incident may have damaged the organisation's reputation, the transparent and proactive response can contribute to rebuilding trust over time. The organisation's commitment to addressing the issue and implementing changes demonstrates accountability and dedication to patient privacy. This outcome involves tangible changes in policy and procedures, demonstrating a commitment to continuous improvement. This proactive approach can strengthen the organisation's overall data protection framework, reducing the likelihood of future breaches. Providing additional training for healthcare science assistants emphasises the organisation's commitment to ensuring that its staff are well informed and equipped to handle data responsibly. This contributes to a culture of awareness and compliance within the organisation. So the T-level Healthcare Science Content Buster on ethical and legal framework and research and professional practice supports students by ensuring clarity on employment conditions, rights, responsibilities and duties, enables fair treatment access to statutory rights and dispute resolution mechanisms, provides awareness of Employment Relations Act and Employment Rights Act, safeguards employment rights, wages and entitlements, highlights the importance of DBS checks, ensures a safe environment for patients and instills trust in healthcare services, guides ethical behaviour, defines professional standards and clarifies organisational responsibilities, maintains patient safety, fosters trust and ensures professionalism, stresses the importance of regulatory bodies like the GMC and NICE in setting ethical guidelines, ensures patient trust, safe care and adherence to best practices, emphasises the importance of accurate and legible records in healthcare, and contributes to patient safety and legal compliance. This content equips students with a strong foundation in ethical and legal frameworks, enabling them to provide high quality care, maintaining patient safety, and uphold professional standards. Thank you for watching.